Have you ever woken up feeling completely drained despite a full night of sleep? It's a disconcerting feeling that many people dismiss as just being tired. But what if this is actually a signal from your body trying to tell you something important? In this video, we'll uncover 5 subtle symptoms that could indicate the presence of cancer. These are signs that many people might overlook, but they are crucial for early detection. Identifying these signals could make all the difference in saving your life or the life of someone you care about. Stick around until the end, because we will not only reveal these little-known signs, but also share a powerful natural recipe to help combat cancer, supported by scientific research. This information is rare, so let's dive into this journey of health and awareness together, starting right now. Before we continue, if you find this video helpful, please give it a thumbs up. It helps me spread this important message. If you haven't subscribed yet, I highly recommend you do so, and turn on the notification bell so you never miss out on valuable health tips. And if you like the content, comment with a healthy life. Or if you don't, comment with a unhealthy to let me know how I can improve. Now, let's get into it. The first sign to watch out for is unexplained extreme fatigue. This is one of the most common yet overlooked symptoms that something might be wrong inside your body. It's not the usual tiredness from a restless night or a busy day. This is a deeper, persistent exhaustion that lingers even after a full night's rest. It can last for days, weeks, or even months. Unlike regular fatigue, which usually improves after a good night's sleep, this kind of exhaustion doesn't go away, and it could be a red flag that cancer is developing. But why does this happen? When cancer cells begin to grow, they consume a lot of the body's energy. These cells multiply quickly and steal resources from healthy tissues, making the body work harder just to function normally. The body may struggle to meet the energy demands of its everyday processes, while also fighting the malignant cells. Additionally, cancer can release chemicals into the bloodstream that disrupt the body's energy regulation. Research shows that fatigue is one of the most frequent symptoms reported by cancer patients, often even before an official diagnosis. A study published in the British Journal of Cancer found that about half of cancer patients reported extreme fatigue with no apparent cause. This type of fatigue isn't helped by rest and is different from being tired from stress, aging, or lack of sleep. If you notice persistent, unexplained exhaustion over an extended period, it's crucial to seek medical advice. Fatigue can also be an early warning sign of blood cancers like leukemia or lymphoma. These cancers affect the blood and the tissues that produce blood cells, leading to symptoms like fatigue, unexplained weight loss, and infections. Recognizing fatigue as a serious issue early on can make a huge difference in your chances of recovery. Next, we have excessive night sweats. This is another symptom that many people overlook or attribute to less serious issues like menopause or a simple fever. However, night sweats can also be an early indicator of cancer, especially lymphomas. When cancer develops, the immune system activates to fight the tumor, which can trigger an inflammatory response throughout the body. This inflammation can lead to fever, which results in night sweats. Unlike normal sweating, cancer-related night sweats can be so intense that you wake up drenched in sweat, needing to change your sheets and pajamas. A study in the Journal of Clinical Oncology found that up to 30% of lymphoma patients experienced night sweats as one of the first signs before being diagnosed. These sweats can also happen when the body's temperature regulation system is disrupted by cancer cells, causing persistent fevers or excessive sweating during the night. If you wake up soaked in sweat, even if the room is cool, it could indicate something more serious. Lymphatic cancers like Hodgkin's lymphoma or non-Hodgkin lymphoma are often linked to this symptom. Additionally, other cancers affecting the endocrine system, such as carcinoid tumors, can cause hormone imbalances that lead to night sweats. If you notice this symptom, especially when it's accompanied by unexplained weight loss or fatigue, it's essential to seek medical advice. Early detection can make a significant difference in treatment outcomes. The third sign we'll discuss is sudden weight loss without any obvious reason. It can be alarming when you lose weight without changing your diet or exercise habits. Significant, unexplained weight loss is often one of the first signs of cancer, particularly cancers of the digestive system, lungs, or pancreas. Cancer cells use a lot of energy, which can lead to rapid weight loss, even if you're eating normally. This loss of weight can also occur as the body's metabolism is disrupted, further contributing to fatigue and weakness. If you experience unexplained weight loss, it's important not to brush it off. It could be a sign that your body is struggling with something more serious. When weight loss occurs without any intentional lifestyle changes, it should be evaluated by a healthcare professional. Throughout this video, we've covered some important signs that could indicate cancer, but recognizing these symptoms early is just the beginning. If you notice any of these red flags, don't wait for them to get worse. Seek medical advice promptly. Early detection can dramatically improve the chances of successful treatment and recovery. If you found this information valuable, please comment "Healthy Life" to let me know you're still with me. Your awareness could be the key to saving a life. Unexplained weight loss should never be ignored, as it can be a clear indication that something is wrong with the body. While many people associate weight loss with changes in diet or physical activity, when it occurs without any intentional lifestyle changes, it can signal a more serious underlying issue. Weight loss caused by illness is often abrupt and severe, leaving the person feeling weak, fatigued, and drained of energy. This kind of rapid decline in weight is usually not the result of a healthy, gradual process. Several types of cancer are closely linked with unexplained weight loss, especially those affecting the stomach, pancreas, esophagus, and lungs. However, it's important to remember that nearly any type of cancer can present with this symptom. According to the American Cancer Society, about 40% of people diagnosed with cancer report significant weight loss as one of the first signs of the disease. This rapid weight loss happens because cancer disrupts the body's metabolism, causing it to burn energy abnormally, even when the individual isn't engaging in physical activity. As the disease progresses, the cancer cells consume vital nutrients to grow, which depletes the body of necessary resources, leading to muscle and fat loss. This continues even if the person is eating normally. In particular, cancers that affect the digestive system can interfere with the body's ability to absorb nutrients. This can make it even more difficult for the body to properly utilize the food it takes in, leading to unexplained weight loss. Research published in the Journal of Sarcopenia and Muscle shows that up to 80% of people with advanced cancer suffer from a condition known as cachexia. This condition is characterized by extreme weight and muscle loss and is commonly associated with cancers of the pancreas, stomach, and lungs. Cachexia is especially concerning as it not only causes weight loss, but also leads to severe weakness, fatigue, and a drastically reduced quality of life. Another possible cause of sudden weight loss in cancer patients is the release of certain substances by tumors that alter the body's metabolism. These substances can affect the breakdown of fats and proteins, leading to weight loss even before the cancer is detectable through conventional tests. Additionally, chronic inflammation caused by cancer can raise the body's energy needs, which can contribute to involuntary weight loss. The American Society of Clinical Oncology advises that any unintentional weight loss of more than 5% of a person's body weight over the course of 6 to 12 months should be thoroughly investigated. For example, a person who weighs 70 kilograms and loses more than 3 kilos without changing their diet or increasing physical activity should recognize this as a sign of something more serious. Involuntary weight loss is one of the most common symptoms seen in advanced stages of cancer, but it can also occur in the early stages. In fact, unexplained weight loss often precedes more obvious symptoms like pain or extreme fatigue. If you or someone you know is experiencing unexplained weight loss, It is essential to consult a healthcare professional immediately. Early detection of cancer greatly increases the chances of successful treatment. Don't wait for other symptoms to appear. Recognizing weight loss as a potential warning sign can lead to an earlier diagnosis, which can have a profound impact on treatment outcomes. It's also important to note that weight loss caused by cancer doesn't always come with other obvious symptoms, such as fever or pain. Many people might feel relatively well overall, even as they continue to lose weight. This is why paying attention to subtle signs, such as unexplained weight loss, is critical. Another sign that should raise concern is waking up with unexplained pain. Persistent pain, especially if it appears without an obvious cause, can be a red flag for cancer. Pain is often underestimated, dismissed as muscle strain or the result of stress, but it can be an early indication of a serious health issue, including cancer. The pain may be felt in various areas, such as the back, joints, or limbs, and it may be particularly noticeable after waking. Certain types of cancer, including lung, prostate, and breast cancer, are commonly associated with pain that occurs when the cancer spreads to bones, muscles, or nerves. Bone pain, in particular, is a common symptom in the later stages of cancer, including metastatic breast cancer, which can spread to the spine, ribs, or pelvis. The pain is often described as deep and persistent, intensifying over time, and not improving with rest or changing positions. In cases of lung cancer, chest or shoulder pain may be worsened by deep breathing or movement, caused by the tumor affecting nearby structures. Pain may also arise in cancers that affect the nervous system, such as brain tumors, or those that metastasize to the spine. Neuropathic pain, often described as burning, tingling, or electric shock sensations, can also occur in these cases, typically worsening after sleep. In fact, many cancer patients experience more pain in the early morning hours before they have a chance to take action to alleviate it. If pain upon waking is persistent and there is no clear explanation, it's crucial not to ignore it. Even if the pain seems insignificant at first, if it persists, seeking medical advice can help ensure early detection and treatment. The earlier a problem is identified, the more successful the treatment is likely to be. Being aware of these signs can make a significant difference in catching cancer early, allowing for more effective treatment and better outcomes. If you're still watching, please comment below to let me know you're staying with me. Thank you for your attention and time. Lymph nodes are an essential part of the body's immune system, acting as filters that help protect us from harmful substances, including cancer cells. According to the American Cancer Society, when cancer cells spread throughout the body, they often settle in these lymph nodes, causing them to enlarge and form noticeable lumps. Initially, these enlarged lymph nodes may not be painful. However, over time, they can become tender or sensitive, signaling a potential health concern. One type of cancer that is frequently associated with swollen lymph nodes is lymphoma, which affects the lymphatic system. Lymphoma can cause swelling in areas like the neck, armpits, or groin. Similarly, leukemia may lead to abdominal swelling due to the accumulation of abnormal blood cells, complicating the diagnosis. A study in the Journal of Clinical Oncology found that patients diagnosed with lymphoma often report noticing lumps in the early stages of their condition, making early detection critical for timely intervention. Cancer types, such as breast cancer, can also cause lumps in the breast or surrounding areas, including the armpits. These lumps may be detected through self-examinations or during regular medical checkups. The American Cancer Society emphasizes the importance of self-exams, as early detection of lumps can significantly increase the chances of successful treatment. Testicular cancer, which is more common among younger men, may manifest as swelling or lumps in the scrotum. Early identification of such lumps is crucial for swift diagnosis and treatment. Liver cancer and pancreatic cancer can also lead to abdominal swelling as tumors press against nearby organs. These conditions often present with additional symptoms like persistent abdominal pain and unexplained weight loss, which can make diagnosis more challenging. It is important to remember that not all lumps or swellings are cancerous. Many benign conditions, such as cysts or lipomas, can cause similar symptoms. However, if a lump or swelling persists for more than a few days, grows larger over time, or becomes more painful, it's crucial to consult a medical professional for evaluation. Early diagnosis is essential for effective treatment across various types of cancer. Research has shown that patients who notice changes such as lumps or swelling are more likely to seek medical attention promptly, which often results in earlier diagnosis and less invasive treatment options. The Oncology Nursing Forum highlights that recognizing changes in the body can lead to more effective management and improved outcomes. Therefore, if you notice any unusual lumps or swelling, it's important not to ignore them. Seeking medical advice without delay can significantly improve the chances of successful treatment and enhance your quality of life. Paying attention to these signs and taking proactive steps toward your health can save lives. In addition to recognizing symptoms early, there are steps you can take to reduce your risk of cancer. Prevention plays a crucial role in the fight against cancer, and while no approach guarantees complete protection, certain lifestyle changes can significantly lower the risk. First, maintaining a healthy diet is essential. A balanced diet, rich in fruits, vegetables, whole grains, and lean proteins, has been linked to a lower risk of various cancers. A study published in the Journal of the National Cancer Institute found a strong association between the consumption of fruits and vegetables and a reduced risk of colorectal cancer. Including antioxidant-rich foods in your meals can enhance your immune system and provide additional protection against cancer. Regular physical activity is also vital in reducing cancer risk. The American Cancer Society recommends at least 2.5 hours of moderate physical activity each week. Engaging in activities like walking, cycling, or swimming can lower your chances of developing cancers such as breast or colon cancer. Exercise also helps in weight management, which is another important factor in preventing cancer. Avoiding tobacco and alcohol is crucial in reducing cancer risk. Tobacco use is responsible for approximately 30% of all cancer-related deaths, including lung, oral, and bladder cancers. The Centers for Disease Control and Prevention, CDC, warns against smoking, chewing tobacco, or being exposed to secondhand smoke. Alcohol consumption, especially in excess, has been linked to several types of cancer, including breast and liver cancer. Limiting alcohol intake can help reduce this risk. Maintaining a healthy weight is another important factor. Obesity increases the risk of developing cancers such as breast, prostate, and liver cancer. Studies have shown that losing excess weight can lower cancer risk and improve overall health. Knowing your family history is also crucial. If there are instances of cancer in your family, discussing this with your healthcare provider can help assess your risk and determine appropriate screening tests. Genetic testing can provide valuable insights into your susceptibility to certain cancers, allowing for tailored preventive measures. Incorporating these lifestyle changes, maintaining a healthy diet, staying active, avoiding harmful substances, managing weight, and understanding your genetic risks can significantly reduce your cancer risk and improve overall well-being. Early detection, combined with proactive health practices, is the best strategy for preventing cancer and promoting long-term health. If you're still with me and finding this information helpful, please comment below to let me know you're still watching. Turmeric and ginger have long been celebrated for their remarkable healing properties. Turmeric contains curcumin, a powerful compound known for its strong anti-inflammatory and antioxidant effects, both of which have been the subject of numerous studies, especially regarding its potential role in cancer prevention and treatment. Ginger, similarly, is recognized for its ability to reduce inflammation and combat oxidative stress, both of which are linked to the development of chronic illnesses, including cancer. When combined with nutrient-dense greens like spinach and kale, this drink not only provides significant anti-cancer benefits but also boosts overall health by supplying essential vitamins, minerals, and antioxidants. It's important to note that while this drink is packed with these health-boosting properties, it should never replace professional medical treatment. If you or someone you know is undergoing cancer treatment, always consult with your healthcare provider before incorporating natural remedies into your routine. Some medications may interact with ingredients in this drink, so professional guidance is vital. To prepare, start by gathering all of your ingredients. In a blender, pour the warm water. Ensure it's not too hot to preserve the effectiveness of the turmeric. Add the turmeric powder and freshly grated ginger to the blender. These two ingredients are the main stars of the recipe, offering potent anti-inflammatory and antioxidant properties. Next, squeeze the juice of half a lemon into the mixture. Lemon adds a refreshing flavor and is also rich in vitamin C, which helps strengthen the immune system. If you prefer a sweeter drink, you can add honey, but this step is optional. Raw, unfiltered honey offers antibacterial properties and can also soothe the digestive system. Lastly, toss in the fresh spinach and kale, which are both packed with vitamins and antioxidants that promote overall health. Blend everything until smooth. If you prefer a smoother texture, you can strain the mixture to remove any remaining ginger or leafy greens. Pour the drink into a glass and enjoy it immediately to get the maximum nutritional benefits. This turmeric and ginger green drink is simple yet potent, designed to support overall health. Whether you're consuming it as a preventive measure or as a complement to medical treatment, this drink helps nourish the body, fight inflammation, and potentially reduce the risk of chronic diseases, including cancer. For the best results, it's recommended to drink this in the morning on an empty stomach. This will allow your body to absorb the nutrients effectively before it starts processing other foods. It can be consumed daily for a period of 1 to 3 months, depending on your individual health needs and any advice from your healthcare provider. While this drink can be a valuable addition to your routine, always follow the advice of your doctor, especially if you're undergoing medical treatment or have existing health concerns. Now let's take a look at the individual benefits of each ingredient. Turmeric is rich in curcumin, which has powerful anti-inflammatory and antioxidant effects. Studies suggest curcumin could play a key role in fighting cancer by inhibiting the growth and spread of cancer cells. Research has shown that curcumin can even promote the programmed death of cancer cells, particularly in breast cancer. Ginger also offers strong anti-inflammatory and antioxidant properties. Studies have highlighted its potential to reduce the growth of cancer cells and prevent metastasis, particularly in colon and pancreatic cancers. Its ability to reduce chronic inflammation is also important in preventing many chronic diseases, including cancer. Lemon is an excellent source of vitamin C and antioxidants, which support the immune system and protect cells from oxidative stress. This makes lemon an important food for cancer prevention and overall wellness. Its acidity also aids in detoxifying the body and improving digestion. Spinach is loaded with antioxidants and nutrients like lutein and zeaxanthin, which have been linked to a reduced risk of breast cancer. Spinach also supports eye health and boosts the immune system, making it a versatile and valuable ingredient. Kale, rich in glucosinolates, supports detoxification and may reduce cancer risk by interfering with cancer development processes. Studies show that consuming cruciferous vegetables like kale may lower the risk of colorectal cancer. Incorporating these ingredients into your diet can be a delicious and easy way to improve your health and potentially reduce your cancer risk. This green drink is packed with essential nutrients, helps strengthen the immune system, and supports overall wellness. While this drink has incredible potential, always view it as a complement to your healthcare routine, not as a replacement for professional treatment. Always seek medical advice before making significant changes to your diet, especially if you are managing a health condition. As we wrap up today's discussion, let this message serve as a reminder. Taking charge of your health and incorporating positive habits can lead to incredible improvements in your well-being. Whether you are already facing health challenges or looking to prevent them, it's never too late to start. Remember, no matter the situation, there is always hope. There are countless stories of people defying the odds and overcoming even the most challenging conditions. A proactive approach to health, combined with hope and perseverance, can make all the difference. If you found this video helpful, don't forget to like, share, and subscribe to our channel for more content that supports your journey toward better health. Your support means so much, and together we can create a positive and empowering community. Let's keep growing, learning, and taking care of ourselves every step of the way.